Hello, I'm Dr. Anthony Wheeler, and I'm telling you everything that you need to know about pathology. Do you recognize this image here? If you're a future cardiac surgeon, you probably know. This is a cardiac tumor, specifically a myxoma. We're going to be talking about cardiac tumors pathology today. This information is covered in your book, Medical School Pathology and Step 1 Review. You can scan this QR code to get access to the website where all the updated materials are. Also, make sure you're subscribed, right? And share the information with your friends, right? Friends helping friends is a lovely thing. I want to see you guys win. Anybody who listens to me, I want the best for you, okay? And I'm going to do my best to help make sure that you have what you need. So, cardiac tumors. Cardiac tumors are neoplastic conditions that affect the heart. Again, we have this histologic section showing a myxoma, right? It looks kind of like gelatinous, this bland eosinophilic or pink color, right? This one in particular came from the atrial, but we can't tell that microscopically. Now, some cardiac tumors to be aware of include myxomas, rhabdomyomas, and metastatic tumors to the heart, which are the most common. Let's start with myxomas. So myxomas are benign mesenchymal tumors. And here we have representative histologic sections from a patient that had myxomas. Note the bland appearance. Myxomas are the most common benign primary cardiac tumors. Myxomas typically present with some sort of tachycardia or dyspnea on exertion. Myxomas typically appear as pedunculated masses in the left atrium on imaging, but here we actually have the gross specimen of a myxoma. Myxomas may cause syncope by blocking the mitral valve. And myxomas typically have a histologic appearance showing an abundance of substance and a gelatinous appearance. Right? You see that? Now let's talk about a different cardiac tumor that you must be aware of, a rhabdomyoma. Now, rhabdomyomas are benign hamartomas of cardiac muscle. In this image, we have a rhabdomyoma that was surgically excised from a patient. It's about 6-ish centimeters total. Now, rhabdomyomas are the most common type of cardiac tumors in children. In particular, patients with tuberous sclerosis are at an increased risk of rhabdomyomas. Rhabdomyomas normally arise in the ventricles. And here's a number of histologic sections that you don't need to worry about. It's highly likely that you will not ever see this. But if you're a future pathologist, you might be curious about the various stains. But for everyone in general, keep in mind that myogenin is a good marker for skeletal muscle. So you probably will need to know that. Myogenin can stain muscle, right? But for the most part, don't worry about this one. Do keep in mind that rhabdomyomas have a unique histologic appearance, as we can see in part A, which is a low power view of a rhabdomyoma. It's next to a hypercellular area from the parathyroid. In part B, we can see normal striated muscle intertwined with the tumor cells. And in C, we could see a high power view of the rhabdomyoma. You see that? The eosinophilic appearance with the nuclei pushed off to the side. Rhabdomyoma. Now let's talk about metastatic tumors to the heart. In the heart, metastatic tumors occur more frequently than primary tumors. Yes. It's more likely that a heart tumor is due to a metastasis from another location, and it's less likely that that tumor grew in the heart somewhere. Examples of tumors that may metastasize to the heart include breast cancer, lung cancer, melanoma, and lymphoma. Metastatic cancers to the heart most commonly involve the pericardium, leading to a pericardial effusion. And here's a representative histologic specimen that shows a leiomyosarcoma that metastasized to the heart in a particular patient. And with that, this was a short one, a lot of important information. Some of it is going to show up, I guarantee it, but good for you that you reviewed it and you know it. You have your book, you took notes, you've been paying attention. That's why I'm proud of you. That's why everyone is so happy that you're going to be a doctor. Can you believe that? It's an amazing thing, and I'm glad I'm part of your journey. If you have any questions or concerns, let me know. Make sure you're subscribed and have access to the website. Keep using your book. Keep studying, and I'm rooting for you. See you next time.